I will give the floor to Gulcin Gumus. Gulcin is the Research and Policy Senior Manager in Eurordis. So as I said before, the Federation of Patient Organizations in Europe. And she has a molecular biology and genetics background and a PhD in fetal and perinatal medicine. And she will talk about the role of patient organizations in advancing rare disease research and diagnosis. Flores. Thank you.
I have a microphone. Okay. Okay. Hi, everyone. So today I'm going to talk about how we as patient organizations advancing research on diagnosis, how do we contribute? And I'm going to give some examples that we did at the Solve-RD project, and I'm also going to talk about our plans for the future. So for the ones who don't know Eurordis, we are an umbrella patient organization that works across countries and diseases to improve the lives of people that are living with rare diseases and their families. And we have more than 1,000 members from 74 countries, and our members are also national alliances of rare disease patient organizations, but also European federations for specific rare diseases. So we work for better lives and cures for people that are living with a rare disease. And how do we do that? We do that by advocating, empowering, and engaging patients in different areas like research, diagnosis, basically everything that is relevant to rare diseases. So to talk about the undiagnosed community, we need to talk about first, we need to recognize that there are different groups of undiagnosed patients. So the reason is different. So depending on the reason, we have to have different approaches. So if the individual is undiagnosed because a disease cause has not been identified, we have to improve research. But if the individual is undiagnosed, so not yet diagnosed because the individual has not been referred to the appropriate clinician, we have to improve the access to diagnosis. So I'm really going to move fast with this slide, but we know that the rare disease, the people living with rare disease, they have a really long road to diagnosis. The average time for the diagnostic odyssey is 5 years. And there's also lack of coordination between healthcare, research, and also lack of clear pathways for patients to navigate in the healthcare. We know that from the surveys that we have done within Eurordis, that rare disease patients are willing to share their data, even if the research is not going to benefit directly on their rare disease, and they're really eager to participate in research. What they want is to have quality relationship with the researchers. They want to receive clear information about the projects, and they want to have the possibility to discuss and ask questions directly. So they really want to bring the added value of the rare disease patients to research. So keeping that in mind, with the Eurordis involvement in Solve-RD, we have contributed in different levels to the project. So first of all, we have contributed to work package 3, where we developed the Winter School on Scientific Innovation and Translational Research. And then with the work package 5, we have set up a community engagement task force. We're also members of the steering committee, and with the independent ethics advisory board, we wanted to review all the ethical aspects of the research that is being done on the rare disease within the project. So to give you some examples, the Winter School on Scientific Innovation and Translational Research is a capacity building training for rare disease participants, patients, and this is training that we have done 5-day intensive training, which gives information about the preclinical research and how translational research can benefit rare disease patients for them to advocate on their rare diseases. So we have started the first edition together with the Imagine Institute in Paris, and we trained 30 patient representatives, which included the topics that are history of genetics, diagnostics, sharing patient data, and new technologies in gene therapy. So this is a training where we wanted to have a lot of interaction with participants between clinicians and researchers. So we had a lot of expert speakers coming from across Europe to deliver this training. The first 2 years we have done it face-to-face, but then due to COVID, we had to do it online. But we also have other training modules and pre-training. And when we did the training face-to-face, we were giving the opportunity for the patients to visit the labs where PhD students do their research, where the preclinical research is made. We have visited the animal labs, and we had the opportunity to interact with the researchers, the PhD students, and the participants. So it was a two-way communication, because not only the rare disease patients want to talk to the clinicians, but there are some PhD students that they do their research on rare diseases, but they have never met rare disease patients yet. So this was a really good opportunity. We had 5 editions so far. We have trained 135 participants. And I'm happy to say that next edition is going to be face-to-face in Barcelona. And I have to say that the first 3 years of this project was funded by Solve-RD, and now it's funded by the EJP-RD project. So another example is the Community Engagement Task Force, which is a multi-stakeholder task force that includes 25 members that are from organizations that are interested in undiagnosed patients. And also we have different experts on diagnosis, like genetic counselors, researchers, clinicians, and also patient experts. So together with them, we have gathered and talked about the topics that are concerning the undiagnosed disease community. This is an example of the infographic that we have done to depict the long and frustrating journey of the patients that they go through when they are looking for a diagnosis. And here we wanted to show also the importance of patient organizations and how they should be included much earlier in the process, not only after genetic testing, but they should accompany the patients even before. We also put here the resources for professionals and the rare disease participants to use. And these are the reactions. I know that you cannot see all of them, but it was really a lot of information and creating awareness for not only the patient organizations, but also people who are doctors and from research institutions. They really appreciated it. They volunteered and they translated this into 24 languages so that they can use it in their local advocacy purposes. We also did a survey for the incentives and key advices for the undiagnosed organizations, and we are also writing a white paper on the importance of having a multi-stakeholder task force in research projects, and also including recommendations. So looking at the future, what are we going to do next? So we are going to keep continuing contributing to research with projects like Screen for Care, RD Partnership. We also have a diagnosis survey that we have completed and now we are analyzing. We are also going to support at the national level with the joint action on ERN's integration on national healthcare systems, which includes a work package on undiagnosed. We're going to keep advocating at the EU level with national alliances and also promoting the needs of rare disease patients within the events that are being done within the EU presidencies. And we're going to keep supporting at the international level together with UDNI and Global Commission. But more importantly, we're going to give support to the community together, collaborating with the Undiagnosed Day and also ad hoc support. We also have our website with a lot of resources for patients. So going back to the beginning, we had said that we need different strategies for different groups of undiagnosed patients. And here we have a couple of key points that we have learned through the process. So we have to encourage the ethical and responsible data sharing. We have to pursue research and reanalysis of data, and we have to do capacity building for patients. And importantly, we have to include multi-stakeholder working groups in the research projects. And to improve access to diagnosis, we need the national programs of undiagnosed to have clearer referral pathways and unique access points, and patient organizations, we should provide support, information, and resources for the undiagnosed. And more importantly, we have to have collaboration between healthcare and research programs so that we can support the creation of active and well-connected communities and advance rare disease research and diagnosis. Thank you.
Thank you, having kept the time. Do you have questions for Gulcin? I just have one, and in order that we can move on. So I'm curious to know if you are assessing the long-term impact of the trainings, so so the educational programs that you are doing, how so the trainees have an impact later on. Are you systematically surveying that or not?
Yes, actually, we are doing that together within the EJP-RD projects, and I think we are going to publish the results very soon. But we know that the patients are using the training that they have done for their advocacy purposes and for contributing to research, but not only as project partners, but also critical reviewers for their research projects, and also applying themselves like in a funding scheme of, for example, EJP-RD network supporting scheme. So they're using it in various ways.
Thank you very much. Brilliant.